So yeah, we'll keep talking here. So that's the first slide. I think it's just an intro and a little bit about contact. So if we go to the next slide. So Contact provides information and advice, so through our helpline, through our website, and that's across the country, and we support right across different disabilities, so SEND broadly, but specifically, rare conditions and mental health and all those things you can see there, and learning disability and autism. So we're quite a broad interest, organisation, and we quite often signpost families to other organisations. Do you want to take us to the next slide? So we have a fantastic helpline, which is really useful to families. Okay, so this animation I don't want to say too much about. I'm just going to suggest that we go ahead and play the animation, and if you've got your sound linked up, Rachel, that's really helpful. And then we can talk about it afterwards. Oh, you might.
Hi, my name's Alex. I live with my mum and my cat Derek. Today, my mum has taken me to hospital for an appointment. I wave goodbye to Derek and get in the car. When most people go into the atrium, the entrance to the hospital, they focus on where they need to go. They might focus on a sign that points them in the right direction. They might focus on a helpful face. But for me, it's a different story. For me, it's a bombardment of my senses. Let me talk through what happens as I enter the hospital. My eyes. As the sun moves behind the clouds, it casts random light and shadows on the floor as I move across the hall. These uncertain patches of light and dark make the ground feel unstable. The different tiles on the floor makes my walking unsure. As I look down, the floor looks uneven. I try to slow down, but my mum tries to speed me up. Each of the public art fights for my attention, not one dominating, but all invading my sight. My ears. They hear everything without filter. Mum's shoes on the tiled floor, staff chatting, machines beeping, the coffee machine hissing. The hand dryer in the toilet screaming. All these sounds bounce around the hard walls, up to the ceiling of the atrium and back down into my head. I cannot stop any of these sounds entering my ears. My nose. The smell of coffee envelops me. It's like being in a dense fog. I can't escape. The oven in the cafe pings and more smells are released. I can also smell the cleaning products used before people arrived. As I move across the hall, each person offers an unwanted smell, often perfume or aftershave.
Take some time now. Really focus on all the things you can see, hear, smell and feel. No, really take time. For example, how does the texture of the chair you're sitting on feel and affect your body? What can you hear inside this room, outside this room, inside your body? Take some time now to think about Alex's story will affect what you do and how you support children and young people with autism.
Thank you so much. Thank you, Rachel. When we started the project, it was a collaboration. So we came together with Contact and NDTi, but initially it was the Parent Carer Forum in the Northwest, and our leads there, Kath, Bromfield, who identified the opportunity with NHS England funding, and Lisa Cooper, who's a director at Alder Hey. And the collaboration began really with the parent carers, and soon after the youth forum at Alder Hey, really leading the work together with the staff. And I think that's been a really important part of the work. And what you heard there was some of the young people who were involved in the youth forum and also in the Sefton Chameleons, so CAM's self-advocacy group, who came into the hospital to record those voiceovers. And the script was based on the listening work that we did with the young people. So that's just a bit of background about the animation that we saw there. So just to tell you a bit about the projects, of the aims of the project. So we began it last year, end of last year, and we were aiming really to work across the hospital. And that was something that came across quite strongly from families and from young people. The NHS England funding was initially for inpatients. Actually, families said, no, we need to look across the hospital at what's happening, at what the journeys are, because the inpatient element is just a small aspect of what a lot of families will experience, which is A&E, which is, you know, the journeys into outpatients and the interactions with staff and with volunteers and all of the people at Alder Hey. So we wanted to support clinicians and, you know, the non-clinical staff to understand the perspective of children and young people coming into Alder Hey, and to actually map some of those journeys and look at the journeys through the eyes of the young people and the families accompanying those young people, and then to improve that experience, and really look at, you know, how those young people's sensory differences can be supported coming into the hospital through person-centred pathways, and quite often that starts before the hospital visit, doesn't it? And then experiencing what we described as a more flexible environment, but often that was about interactions with staff. So the role of staff and practice and discussing with staff from the perspective of the young people. So NDTi and Julie were involved in the training aspect and led that. So we'll talk a bit more about that in a moment. Let's go on to the next slide. This statistic comes from Joanne and Lisa, doesn't it, in the hospital. So the senior nurse involved in the project estimates that around 60% of children visiting outpatients might have some form of sensory difference. And we're thinking about children with, you know, with autism who might have a sensory difference, also children who might have a sensory impairment, who might have you know, other reasons why they experience sensory inputs in a different way. And so thinking then about the background of this project and the timing of it was happening right when you know, things COVID-19 had a big impact on the hospital and on the environment, and on the, you know, the hand sanitizer on the way in. You've got less in terms of things to touch and play with in the waiting rooms, and that experience was really coming across quite strongly that families were struggling. Some families were struggling with that. You know, changes. So although there were fewer people going into hospital, perhaps because of the reduction in numbers over the COVID period, there was actually quite a difference in the experience. And the NHS England funding was for looking at how environments impact on quality of care for children with sensory difference. And the other projects that came within this funding were actually mental health and tier 4 projects, I think, around inpatient services. So this was the only one where we looked at you know, a big children's hospital. And we drew on evidence that NDTi had produced, Experts by Experience had produced, called It's Not Rocket Science, and that is based on mental health inpatient units. So some of the experiences in a big hospital like Alder Hey might be slightly different, but a lot of the principles from that report are similar, and that's a really good one to start with if you're interested in these issues. So we worked obviously with the Alder Hey Youth Forum, as I've described, and the Sefton Chameleons, led by Camille, and I still think that's a great name for a band. Camille and the Chameleons. So the staff listened to those lived experiences, and we used the animation as we developed with the young people in the training. So we'll talk a bit more about that. The project then identified resources, looked at environment, looked at what adaptations might be available, and I'll talk a bit more about that. And the evaluation was completed by Edge Hill University. So there is now, very shortly, I should say, an evaluation that will be published. So that's an independent evaluation that will be published by Edge Hill. And they're also publishing it with sort of bite size, a bit of a video and things. So it should be quite accessible to lay people like me, so that's great. So that will be coming, and you will be able to see from their perspective what works. I'll tell you a bit about today what I think works, and I'm trying to draw on the evaluation, but obviously you will be able to see a lot more detail from that evaluation about what worked in the project. So the next slide, please. And so we covered, I've sort of separated out two kind of areas. So the first one was around learning and improvement, and the second area was around environment. So if thinking about learning and improvement, the parent care engagement throughout was a kind of key area where we think that was a really strong element to the project. And the way that we did that, and obviously young people's engagement as well with the children, was that we started off with a listening exercise. We did surveys. We had over 100 parent carers responding. We had an easy read survey for young people. So we were listening to what parents and families and young people were saying about their experience of coming into Alder Hey and the sensory impact, as you saw there in the video. We also did some one-to-one kind of walkthroughs of the hospital, and that was actually in the lockdown. They were still able to do it because the parent carers were families whose children had appointments in the hospital. So the community OT walked with the family through the route and just listened really in detail about what was happening for that child in that moment, what the family member might be doing to kind of support the child, whether they got a quiet room or whether they didn't, made a huge difference to them, those kind of things, and the interactions with staff, so environment and staff. And then, so as I say, we've had lots of listening work, but also the training for staff. So that was a key element, and we had we invited 100, I think, staff. We had a few less just because staff in hospitals are busy, but we had about 74, 75 staff who came, and NDTi co-led the training, and Thomas Henley is a young person, or a man with lived experience, who led the training fantastically, talking about his own experience of having sensory needs and visiting hospital, and the impact that the hospital can have. And so that was really sort of clear learning that staff had that direct access to that lived experience from both the video that we saw, Thomas's account of his own experience, but also we had a staff blog, didn't we? Do you want to say something about the staff blog, Julie?
Yeah, I mean, just to add, the training was co-designed with the young people themselves as well, and we had input from another young person that I know quite well, an autistic young person who didn't support the delivery of the training but helped with the content. And I think we were very keen, led by autistic people really, that we wanted the content to kind of build on a strengths-based approach. So not looking necessarily at the medical model, but looking at the social model of autism, and hence the language around sensory differences rather than sensory challenges. But we had permission to use a blog that had been written by a member of staff, an autistic member of staff, who'd only fairly recently discovered that she had autism, actually, and had a really magical moment where she was in the training and we didn't know, and she actually identified herself and said, I feel I need to fess up, that story's mine, and kind of shared a bit more of her story, which had such a huge impact, I think, on her colleagues. It was her colleagues in the room. So, one of the legacies, I guess, of the project is to have an autistic experts kind of group within the hospital now who can support other members of staff and support each other as well.
Yeah, I think that's been a great sort of legacy point from the project, that, you know, Alder Hey have, you know, or I think they're setting it up, but we're going to have a neurodiversity group of staff. And I think there was a moment where staff were realising this is not just about the young people and the children and the families, but actually it's about our, you know, everybody. It's about our colleagues as well. One of the other activities that the pilot included was a sort of snapshot audit. So we call it an informal audit because it's not a formal, formally evaluated audit, but it was led by, or in both cases led by, an OT, and the OT who led the work in outpatients actually worked with the healthcare assistant to do the ring rounds ahead of time, so they knew which families were coming in who had a learning disability autism flag. So that flag would tell the clinicians what was that there was a diagnosis, but what they wanted to do was understand a bit more about the sensory things that might be challenging for that young person, to be able to prepare a bit more for the appointment, for the waiting experience, and for the clinical interactions. So that happened. There were 2 sessions. One was in phlebotomy, and that was a really sort of interesting learning piece there in phlebotomy. And, you know, so this picture was from the evaluation. And the evaluation actually heard directly from families who were in waiting areas, and it was an opportunity to gather information direct from the young people, and they got them drawing pictures in their responses. So the methodology on the evaluation was fantastic. Let's come on to the next slide. I'm just aware of time, so I'll keep going. So we had equipment that was, you know, we were lucky enough to have a budget that meant that we could buy a set of sensory boxes. So these are toys that were developed by Fledglings, Fledglings is the not-for-profit website that sells toys and sensory items and various different items. It's part of Contact, and those boxes were, because we were working on the project with them, we were able to develop it with the staff and families. So families were saying, this is what we need. Staff were saying, this is what's wipeable, what's cleanable, what's hygienic, this is what will work. And staff had to say, look, if we put them in the waiting areas, it'll be a mob scene with everyone getting involved, and we can't keep it hygienic. So we had to keep the boxes in the clinical areas and keep them in A&E cubicles. So, you know, there were restrictions, and we worked with the hospital, and they've written a protocol that goes with the boxes so that staff are cleaning them and able to use them. And I think that should extend the longevity of the boxes. Obviously, the toys will need replenishing. So ear defenders and sunglasses, the listening exercise really told us about bright lights, about noise, and about smells. You know, and those things are sometimes hard to avoid, but there are ways that we can support young people. And the staff this morning was saying they're seeing a lot of young people, you know, taking the ear defenders at the concierge, going into the atrium, sunglasses, ear defenders, and then the atrium doesn't feel so overwhelming. The smells, you know, created a lot of nausea and a lot of upset, for anxiety for young people. And I think that's something that hospital designers need to know about. You know, if you put the cafe right at the entrance, what the impact is on young people and children with those sensitivities. So they've both been able to purchase some equipment. The Voyager mobile sensory units are more expensive. The boxes are quite, you know, relatively inexpensive. And so those things have been put in place, but utilising what exists in the hospital as well. So they found that there were projectors and units that were kind of hidden away in parts of inpatient wards where they were being kind of tightly kept hold of, but perhaps not utilised as much as they could have been. So that kind of review of what's available was quite an important part of the project. And then the play specialists and the role of the play therapist. I think they learned a lot about what each other were doing, and sharing their expertise across the hospital with the volunteers and so on as well. They'd identified then additional quiet waiting spaces, and you know, we were able to provide advice on visual, you know, decluttering, how to make your waiting room feel a bit more welcoming. Yes, they want some child-friendly things on the walls, but when there's too much on the walls, what the impacts can be of that kind of thing, and finishes, and things like seating and so on. So we were involving the estates and facilities colleagues in the project as well, which was great, and they were able to install some specialist sound absorbing ceiling tiles in some of the waiting areas. So that's a real benefit, I think, to the project, to the outcomes of the project. Should we do next slide? Yeah, so really we've talked a bit about the kind of listening, and the family feedback around A&E was something that drove where we went with the project. So we said, okay, we're going to try and provide some equipment into A&E to try and make that a more pleasant experience. And again, phlebotomy, where children were saying it's so stressful waiting and I don't like needles, so how can we make that a more pleasant experience? And then this is something, Julie, that we found came through very strongly, was when staff realised actually some of these changes are quite small changes, and these are things that we can do this. It really gives a momentum to the project, and to the staff positively responding, and the things that you will come across if this is your area of expertise, but offering a quiet space to wait away from the busy waiting area meant that child was able to engage with the clinician and wasn't so stressed out that they had to leave before the appointment, which happens. There was a part of the informal audit where the staff had noted the curtain needed fixing. It's so simple, but the families don't want to say so. And when they see the staff being so busy, and that meant the child slept, because that child was very, very sensitive to light, and they were then able to engage in that activity afterwards. So just a really small example of something that's quite simple to fix. Other things take time, and the infrastructure and changes will take longer. Should we go on to the next slide?
Just to add, Mary, what we heard, I think, quite strongly from Thomas, particularly around phlebotomy, was that, the impact of having negative experiences when you're small stays with you forever. So you end up then with a lot of kind of no-shows at hospital appointments because of the anxiety that it evokes. So getting it right early on can have such a huge impact on young people as they move into their adult life.
And the impact on family experiences of families saying, we can't drive past the hospital, we have to go a different route because my child will be triggered. That kind of making that ongoing experience for families easier when they have regular appointments is so important, wasn't it? Yeah, so just thinking, about what worked, and it's great to have this opportunity to sort of stop and reflect about what works. And I've got a summary slide in a minute, where I'm trying to sort of draw from some of the evaluation points, but really I think having that mapping and the journey from the perspective of the young person, but having that community OT who came in and led that was really, really useful, because they walked with the family and they wrote about that in quite a lot of detail, and the staff on the project team were then able to kind of learn from that, which was great. And then having that kind of independent perspective of it. And I think there's been a legacy, which is that the families are going to continue to do those walkthroughs. So we had a couple for this bit of the project, but the good thing is that I really do believe that they will continue to do those walkthroughs, and it's a bit of a kind of mystery shopper experience, but really for sensory, which is a great thing to have kind of to continue with families. So the delivery group has said, they'll continue that, and the positive staff response that we saw means that continued momentum is there, and involving staff in talking about their own lived experience gives some momentum as well. I mentioned the non-clinical teams, so we've had the volunteers in the hospital, we've had kind of concierge front of house, so all of those teams involved have been really has meant that the project has a bit more momentum than just the specialists, kind of obviously the clinical specialists who already kind of understand some of this stuff, I think. So tagline. We came up with this, Julie, I think you came up with this tagline, be sensory curious, and I think that really chimes with a lot of staff, because everyone could do that, and everyone came away from the training saying, oh, that's something I can do, or I'm going to think about and do a little mini audit in my department or in my area. What could work better for your child, and that, you know, so that's been really powerful. Let's go on to the next slide.
Back of us just suddenly becoming so aware of everything sensory, didn't we? You know, I was aware that from this project, everywhere I go, like the noise is so loud, and the smells and the hustle and bustle that I probably hadn't noticed before, just suddenly now much more aware of.
Yeah. So these are some points that I kind of came up with in terms of what I think worked, and drawing on the evaluation. But I'm looking at the time, and we've only got 5 minutes left. So I wanted to just give a chance for people to ask some questions. The final slide after this is about some other projects that Contact has been involved in. We've worked with GNCH and the Great North Children's Hospital on some different projects, but I just wanted to give you a chance to ask any questions you have about this one. If you want to fire away or type in the chat.
No questions really. It's just such a fantastic project, isn't it? I mean, it's just such a relatively small and simple piece of work that's had such a huge impact on all involved, from upskilling for workforce to improving experiences for family. Yeah, it's just really something to be celebrated. It's got me thinking about a much smaller scale project we did during the pandemic, thinking about helping children to access vaccinations, because we had some mass sites we all did, which were quite difficult for some families to access. So we worked with volunteer groups and therapists to come up with a sensory room, which could be booked in advance. And again, that had I'm just trying to find the comms actually, which I'll share the link with, just out of interest, but just much smaller scale. But again, we had some really positive feedback from that as well.
I think that became our strapline as well. Small change, big difference.
Yeah.
It really did feel like that, Chloe. You're absolutely right. It doesn't have to be huge.
Yeah. Leslie, did you want to?
Yeah, I mean, we've done quite a lot of work with Ambitious for Autism. They're our partner at the Whittington, and I chair a group with them around looking at accessibility in the acute services. And we were looking to get the autism kind of friendly standard, but we couldn't really find anywhere that did it. So so we've had a few projects where young people have walked around the hospital and made suggestions, and we've done it kind of on a language and communication basis as well, so with the speech therapist. So I was really interested to see that you're using your occupational therapist, and I think that's a really excellent idea. I'd love to know where you got them from, because we're desperate for occupational therapists. We want to share them. But your audit would be great to see, because that's something that we could roll out, and it would be really nice to have some kind of national recognition. And I think somewhere like Manchester's got an autism friendly airport, hasn't it? And Liverpool's an autism friendly city, and places like that. But actually this is something that we as a hospital wanted to have, and that we could promote as well if we met a certain standard. And I'd be really interested to know whether that's something that Alder Hey is thinking of formalizing, or is it just like something internal?
I mean, that's a really good question. It's not something that we a kind of kite mark type of approach.
No, I did contact the NAS about it and said, oh, could you kite mark us if we did loads of work and made our hospital really accessible? And they kind of sent this thing, but it wasn't really what I was looking for.
I mean, it's interesting, Leslie. I don't think we originally went down the route of it being about autism, actually. I think we were looking much broader, and then not surprisingly shone a light on autism. But you know, it's not just about autistic children and young people and adults, I guess.
But even having child-friendly environments, you know, there used to be the You're Welcome, didn't they?
Yeah, exactly. You know, those of you working in the health world, I think the You're Welcome standards were really good, and I think they need to be revisited and refreshed.
I think so too. I can't remember who led them now.
A plea from us.
But anyway, Mary, I'd be really interested if you did want to standardise them, but it'd be great to see your audit as well, because that's something that could be widespread good provision, and maybe CDC might want to, I don't know, do something around that.
Yeah, that's interesting,
Yeah.
because we hadn't sort of thought about publishing the audits, because they were kind of quite they were being used internally for that staff learning, for them to look at, okay, what's happening in outpatients, some really, you know, quite challenging stuff. So, but maybe there are some, I think we talked about doing some kind of top tips or some learning from that we could put out and share, and I think that would be great, because it was really that role of OTs in that piece, in the audits and the informal audits on the wards and in the outpatients unit areas, including the waiting areas, and that kind of pathway in. Yeah, it was really eye-opening for me, and certainly I think they learned internally, they learned a lot from it. So maybe we can pull out some pieces, you know, some learning that could be shared more broadly. Thank you.
Yeah, I just think it's quite nice to do that benchmarking, isn't it? Yes, we have considered this. Yes, we use visual stories. We have an accessible website, you know, so you can download information before you arrive, and, you know, all those things I think would be really good to quantify, wouldn't it? I think it would then really hold hospitals to account, because you know, they are unfriendly for the best of us, you know, their own kids.
The it's not rocket science report has,
but maybe not older, hey.
The report in It's Not Rocket Science has key principles that we kind of stuck to, didn't we, really? I think they guided us through, particularly with the training.
Yeah, I mean, Older Hay also led all that work, didn't they, with the National Paediatric Toolkit?
They've also done some great work on transitions as well. So their 10 steps to transition is really good.
I know people want to get off. I just wanted to say on the final slide that we've got just to shout that there are some other projects that we've been doing that Ellie, had she been on the call, would have told you a bit about. So I wanted to just flag those and maybe have a look if these slides come around later. But at Great North Children's Hospital, we've been doing sleep and referral project, sleep and behaviour project for families. Kind of where there's a gap in needs, where it may not be a sort of needing a clinical lead, but it can be an experienced senior parent advisor leading the work. So in North East Cumbria, I think one of us is from this area, around admissions avoidance, and that's the SPACE project, which is really includes our listening ear, and it's quite an intensive with a small number of caseload of families. And that's been a fantastic project to prevent admissions avoidance. And then, so just the wider work we do with understanding the perspectives from parents and carers as well as young people. And so we wanted to just flag that to you. If anyone wants to know any more about what Contact can do and can offer, then please do ask me. And if you're interested in getting the reports from the Alder Hay project, I don't know if we can share those, maybe CDC could share them, but I don't know if you want to type in the chat, type your email address in the chat if you want to, so that I can send you the reports when they're hot off the press, because the evaluation report's coming out shortly.
And Mary, I've just quickly popped in there. So Time to Talk, for those of you that don't know, Time to Talk's a programme that NDTi set up during COVID, and it's a free online kind of support planning service for young people with additional needs, and we have got some capacity. So if you're working with any families, there's some criteria around. So we're not therapists, so we don't work with young people who maybe have got significant mental health challenges, although that said, we have done quite a lot with mental health. But yeah, that's available for you to share with your families as well.
Thanks, Julie. Thank you for responding. Thanks for your questions, and enjoy the next session.
Take care,
Thank you so much, Mary. Are you happy for your slides to be shared around to the group?
Yeah, very happy for the slides to be shared. Absolutely, that's fine.
Lovely. Thank you so much. It was fascinating.
Thank you. Thanks very much. Bye.
Thank you.